Listen up, guys. This is the uncomfortable truth about prostate cancer. It's a silent disease. And why? This is simply based on the anatomy of the prostate, the structure of it. Cancer tends to affect the periphery or the outer section of the prostate. Hence, in its earliest stages, when there is cancer within these areas, one will not know. And this is where it gets more interesting. Some men simply think that if they're going to the bathroom often, if they're having difficulty urinating, those may be signs of prostate cancer. Those are signs generally of an enlarged prostate, which we call benign prostatic hyperplasia. If a man has prostate cancer and he starts to have symptoms, unfortunately, it is too late. So how then is it picked up? It can be picked up by diligently seeing your doctor once every year. In our population, that is men who are Jamaican or black in race, over the age of 40, going once every year to have a digital rectal exam done, but even more importantly, having the blood test called the PSA done. Now, the PSA is short for prostate-specific antigen. This is a substance that is made by the prostate and released in the bloodstream. Now, there's a general range mention of 0 to 4, but of course, that depends on the age of the male. If the PSA is within range, then we recommend annual or yearly testing. If the PSA is not within range, we may say have it repeated in another few weeks' time. And if it is still high, especially if there's high risk, so risk factors such as family history, black race, then we definitely want to evaluate further. And one thing that we can do is a prostate biopsy. Now, you might ask, what is a prostate biopsy? It's a simple diagnostic test where we take tissue from the prostate gland. Now, conventionally, this can be done by using ultrasound to assist us. We usually, under local anesthetic, that means not being put to sleep, we place a very small probe up the rectum. When we put this ultrasound probe up the rectum, we can see the prostate. And through this probe, we can advance a needle to pinch pieces of tissue from the prostate gland. This is generally done in a doctor's office, just with some local anesthetic. Men can go home the same day. There may be blood seen from the rectum, maybe for the first 24 hours, or even blood in the urine, but it's a generally safe procedure. And this is called a transrectal ultrasound guided prostate biopsy. Science has evolved, and we have recognized that even doing the biopsy in this way may increase infection rates. And to reduce infection rates, we now can do what is called a transperineal biopsy. Now, how is this done? The ultrasound probe is still placed in the rectum. However, the tissue is taken not through the rectum as in the previous discussion, but rather through the perineum. And that's the skin that rests between the scrotum and the rectum. In going through this area, which again is done under local anesthetic, or if a man so desires under some sedation, you can get the tissue in just as an efficient way, but the major issue is that it reduces infection rates. Now, there are lots of imaging tests that we can do if we suspect or we know someone has prostate cancer. The one I'd like to talk a little bit about is the MRI. So what does the MRI do? It scans the prostate, and it's usually a test maybe about 30 to 40 minutes in an MRI scanner. But it scans the prostate and it can show it with great deal of accuracy if there are any suspicious areas within the prostate. It can show nodules, and a skilled radiologist can give us his opinion of how suspicious these nodules are, which correlates very well with the likelihood of aggressive prostate cancer being there. And we've had the benefit in Jamaica of having multiparametric MRI of the prostate being done for the better part of, I think, 8 to 10 years. We are currently doing studies at the University of the West Indies looking at the accuracy rates of MRI in detecting significant prostate cancer. So listen up for those results soon. So a prostate biopsy may sound complex, but it's really a simple process, and this is how we establish a diagnosis. There are many people who will say, oh, I don't have cancer because I feel okay. But you really don't know. You really don't feel unwell initially. Or they may say, well, my PSA is not too high, or it's just a little bit high, and my prostate is big, so I may not have cancer. But you can't rely on these things. The hard things that we rely on, one, the PSA, which we know is not a perfect test, but important enough to lead to further testing, which includes an MRI and ultimately the prostate biopsy. So the diagnostics includes these things. And once the diagnosis of prostate cancer is established, we then now need to know stage. Very often patients ask, Doc, what's the stage of my cancer? You want to be able to say, is this cancer still within the prostate or has it spread outside? And generally, we can do staging tests such as the MRI we just discussed before. In some cases, you may use a CT scan to determine if there's involvement in lymph nodes, but there's availability of scans like PET scans, which can show us if there's distant spread to other areas. If prostate cancer is localized to the prostate and has not already spread, it is in its early stages, and guess what? It can be cured. Many men have been and will continue to be cured from prostate cancer. So this is something that I think I need to emphasize and is very interesting. I've heard people say men don't die from prostate cancer. They die with it. Rubbish. There are many men who will die from prostate cancer. It is true that some men have what we call indolent or slow growing disease and it will not cause a problem. But in our population, in the country in which we live, which is Jamaica, we have one of the highest rates of prostate cancer in the world. There's been published data for at least 2 to 3 decades documented that. Not only that, most of our population consists of black men who are high risk for prostate cancer. In fact, let's list the 5 common risk factors for getting prostate cancer, risk factors for the disease. 1. Black race. Men who are black are higher risk of getting the disease, whether they live in Jamaica, the US, the United Kingdom, or anywhere on this globe. Black men always have higher rates of prostate cancer. Not only do they have higher rates of prostate cancer, they have higher death rates of prostate cancer. In the United States, black men are disproportionately affected by prostate cancer. They are 1.7 times more likely to get prostate cancer than a white man, and twice more likely to die from the disease than a white man. What's the second risk factor? Increase in age. Young men in their 20s and 30s generally do not get prostate cancer, but it's a disease that occurs as men get older. 40 and above, more likely to get prostate cancer. So it's a disease of the aging male, not necessarily that you must be old to get it, but we've treated many men in their 40s and 50s and above with prostate cancer. Third, family history. Do you know your family history? Do you know if your father had it? Your grandfather? Your uncle? These are questions we need to ask because family history increases the risk of prostate cancer. So let's look at it this way. If a man has one family member who has prostate cancer, his risk of getting it is doubled. If he has 2 family members who have had prostate cancer, his risk is multiplied by 5-fold. If he has 3 family members, the risk is multiplied by 11-fold. Shall I go on? The risk increases with more family members with the disease. It is not true to say that the man must get it, but his risk is significantly higher. And I've treated countless men who have a family history of prostate cancer. 4, genetics. We talk about genes all the time. And genes can confer an increased risk of getting certain diseases. And there have been genes that have been isolated that increase the risk of getting prostate cancer, some of which we see in our Black population, which is particularly aggressive. And 5, the what I call modifiable risk factor is the environment, what we put into our mouths. Let's look at translational studies of men born and living in Asian countries like Japan and China. The Asians in general seem to have the lowest rates of prostate cancer. If they migrate to our Western country, their rates are increased. And if they have children or males who are born in Western countries, their rates are increased. So what has changed? It's where they live. And we believe it has to do with their environment and the diet. So the 4 risk factors I mentioned before, which were Black race, family history, genetics, and increase in age, cannot be modified. But the one risk factor that potentially can be modified is the environment. So prostate cancer can be cured, and there are two major ways of curing prostate cancer. Standard backed by scientific data. This would be surgery to remove the prostate or radiotherapy. Let's talk a little bit about surgery. Surgery can be performed in different ways, but the technique and the method is the same. We can make a cut, which is the traditional open approach. We can use laparoscopy, which is minimal invasive keyhole, or we can do what is called robotic assisted laparoscopic surgery. The net result of surgery is to remove the entire prostate gland while sparing the erectile nerves, removing the glands called the seminal vesicles, which sounds like semen because that's where most of the man's semen comes from, and also at times removing lymph nodes where cancer potentially spreads. It's a procedure that can take anywhere between 2 to 4 hours, depending on the size of the prostate and how aggressive the cancer is. At the end of that surgery, the man has to wear what we call a urethral catheter, which is a tube placed inside the penis. He usually keeps it for about 2 weeks to allow the internal structures to heal. His time in hospital may vary between 2 to 3 nights, and he goes home shortly after. It really is not a painful procedure, and whereas we restrict men from doing strenuous activity for up to 4 to 6 weeks after the surgery, they can do light walking, eating like normal. So what are some of the complications or side effects of the surgery? Guys, I know you're going to be concerned because one, erections can go downhill and urinary continence can go. That means a man may cough or sneeze and wet himself. Now, your erectile dysfunction does occur with a prostatectomy, and it's simply because of where the prostate lies and the proximity to these erectile nerves, these so-called cavernosal nerves. It can be prevented in several ways by surgical technique, but it can be treated even better by early penile rehabilitation. But the truth is, younger men, like less than 50 or 55 years, who have very good erectile function beforehand and really have no chronic illnesses that on their own will affect erectile function, such as diabetics or hypertensive, tend to get very quick recovery. Now, yes, radiotherapy is an option for treatment. It can be delivered externally, where over the course of several days or weeks, small doses of radiotherapy are applied to the pelvic region to kill the cancer cells in different ways. There's something also called seed therapy, which is radiotherapy instilled or inserted in the prostate with a small seed. It's also called brachytherapy. It's a 1-day procedure where under anesthetic, small radioactive seeds are inserted in the prostate. This can be done for cases of prostate cancer that are localized and so-called low risk. But you may ask then, what if my cancer is not localized? Is there no treatment for me? Is there no effective treatment for me? Absolutely not. We do not want to diagnose prostate cancer when it is advanced. However, if we do, there are treatment options. It must be emphasized though, in these cases, the treatment is not curative. It is rather control of reducing the growth rate of this cancer. And the symptoms a man may now get if he has advanced prostate cancer that has spread may include 1, back pain, because the cancer has a predilection for going to the bones in the lower back. Now, I'm not saying all cases of back pain are because of prostate cancer, but if it spreads, it tends to go there. It may go to the lymph nodes inside the abdomen and block the ureters, which are the tubes that carry urine from the kidney to the bladder. So then the patient now has distended kidneys, the urine cannot flow down, and they develop kidney failure, at which time they need to have tubes placed on the inside. Prostate cancer can pretty much spread to anywhere in the body, but the place it likes to go to are the bone, as I mentioned, especially in the back, and the lymph nodes. Sometimes it can bleed, and a man may notice those gushes of blood coming out in their urine, and this becomes an emergency. But the good news is that many years ago, a pair of scientists discovered that if you either use estrogens, which is a female hormone, or if you remove the testes of men by surgically castrating them, you could treat their prostate cancer. And they were rewarded for their work by the Nobel Prize issued in the 1960s. Their names are Huggins and Hodges. So what we do is we offer chemical castration in the form of hormones, either given as tablets or injectables to suppress the growth of prostate cancer. I can think now of a patient whose PSA was high as 6,000 when the norm for him should not have been greater than 4. He walked into the office complaining of pain. His lab showed that he was anemic. He was sick. We sent him to do scans. His bones were riddled with cancer. Got a prostate biopsy, confirmed prostate cancer. Almost 3 years to the date, this man has been on hormonal therapy, getting his shots every 3 months, also on tablets, and his PSA remains less than zero point 0.1. So it is possible to control the disease, but not cure it once it is advanced. There's also the option of administering chemotherapy, and as urologists, we work closely with our medical oncologists, our radiation oncologists, our palliative care physicians to treat these patients. Chemotherapy can be given very early in the course of advanced prostate cancer to have a longer response to hormonal therapy. So, in a nutshell, prostate cancer can be cured if it is localized to the gland, either via surgery or via radiotherapy. If it is advanced or what people call metastatic prostate cancer, treatment is available in the form of either hormones or chemotherapy, and all is not lost.